So welcome to the maintrac videocast. My guest today is Professor Katharina Pachmann. Professor Pachmann is the founder of the maintrac method and with research and publications spanning more than 20 years. Professor Pachmann is the chief scientist for the clinical use and the research of the maintrac method. Thank you for joining us.
Thank you for having me.
It is acknowledged that the maintrac method is the most sensitive method to identify circulating tumor cells out of blood samples. Before we get into the specifics of the technology, could you please discuss the origin and the biology of these tumor cells in the bloodstream?
Well, it is well known that solid tumors can disseminate cells from the tumor into the bloodstream during growth of this tumor. As soon as the tumor is connected to the bloodstream, tumor cells can exit from the tumor into the bloodstream, and they can remain there for a long time because it's known that metastasis from breast cancer can occur even 30 years after the primary tumor.
How big does a tumor have to be before it's connected to the bloodstream and before it disseminates cells into the bloodstream?
Yeah, this can occur already at a very tiny size, like 1 millimeter diameter, because then the tumor needs to be connected to be nourished by the blood.
This is obviously a very small, this is like a pinhead, 1 cubic millimeter. Does that mean that there are tumor cells present in the bloodstream by the time a tumor or cancer gets diagnosed?
Yes, it's they can be present already before the tumor is diagnosed, because normally for diagnosis it's necessary for the tumor to be about at least 5 millimeters. So this is way before the tumor is diagnosed.
This is obviously a very important and interesting question, that we can get access to the information about the tumor out of a blood sample. Now, those cells which come out of a tumor, they're usually epithelial cells and are not meant to survive in the bloodstream. So what's happening there?
Well, that we don't know exactly yet, but the fact that they are different from blood cells due to their surface antigen expression, like the epithelial antigen, we can distinguish them from the white blood cells. And that's how we detect these cells in the blood of patients.
Thank you. I think that would be the topic of our next video cast, to discuss the method that you use and maybe also comparing it with other methods that are being used for clinical use and for research use. Thank you very much, Professor Pachmann.
Thank you.